Hello and welcome to another Drug Demystified video, where we take common medication, demystify them to empower you to understand and manage them better. So in this video we'll be talking a bit about Amlodipine. Amlodipine is a medication which we use to treat blood pressure and also a certain type of chest pain known as angina. It belongs to the group of medication known as the calcium channel blockers. Amlodipine relaxes the blood vessels, improving blood flow and making it easier for your heart to pump. This is quite important when it comes to what we're treating, things like blood pressure, angina, in terms of reducing complications like having a heart attack or a stroke, and managing those symptoms of angina. The dose of Amlodipine, that usually starts at 5 milligrams once a day. And then based on, obviously, blood pressure control or angina control, your clinician can look to increase this to a maximum of 10 milligrams a day if needed. When to take it? With Amlodipine, you can take it once a day at any time during the day. But obviously it's quite important to get into a consistent pattern of taking Amlodipine. So usually it's probably best to take it first thing in the morning so you can remember to take it and get into that routine. What to expect when you take Amlodipine? Well, you may not feel any different, it's worth pointing out, especially if you're taking it for things like blood pressure. But it's still important to carry on taking it. And in terms of seeing an effect, you may see an effect on the same day, but a full effect may not be achieved until a couple of weeks after. So what to do if you missed a dose of Amlodipine? Well, if you missed a dose, take it as soon as you remember, unless it's nearly time for your next dose. And in that case, omit the one that you missed, take the next scheduled dose and carry on taking it as usual. And don't take a second dose or a double dose, as they call it, to compensate for the one missed. Possible side effects of Amlodipine include swelling in the ankle and feet, flushing, headache, dizziness and a pounding heart. In terms of managing side effects, it's worthwhile going on the Sohalogy website where you can find a guide in terms of managing common side effects. That guide may not include things like leg swelling, so if you're finding that you have got any leg swelling, you can try elevating your legs when you're sat down and see if that helps. For the pounding heartbeat, it might be worth reducing things like alcohol, smoking, your caffeine intake, trying to eat smaller meals rather than big meals. And if you find that it's persisting, or if it's severe in nature, then obviously NHS 111 or see your GP clinician. And like always, if you do get any side effects and they're persistent, severe or bothersome, then please consult your GP clinician, NHS 111 and your local pharmacy. When it comes to interactions and Amlodipine, always make sure your clinician has an up-to-date list of medication, including any herbal supplements and over-the-counter medication. And just be aware that a herbal remedy called St. John's wort can affect Amlodipine. Special warnings and things to look out for. It's probably worth bearing in mind that Amlodipine and grapefruit juice don't mix, so it's probably worth not taking any grapefruit juice. And it may cause you to become more sensitive to the sunlight, so bear that in mind. In terms of monitoring your progress on Amlodipine, your GP clinician would want to have a look at your blood pressure, your overall health, and see how you're getting on with Amlodipine, so please attend all regular checkups. Where to find more information and who to contact? Well, more information can be found from the patient information leaflet in your box of medication and also the NHS website. If you find that you're getting any unusual symptoms or you have any questions, then please speak to your GP clinician, your local pharmacy and NHS 111. Right, so that brings us to an end of this video. Thank you very much for watching. As always, if you could please like and share the video, if you can subscribe to my channel and leave me a comment below, and please do not forget to visit the website sohalogy.com. Thank you.